Hi class, my name is Tara Weeds and I'm going to be your facilitator for our BHS 411 course on ethics for the healthcare professional. I'm very excited to get started with class. I hope you are equally excited to learn how ethics play a role in all of our medical professions. It really doesn't matter if you're a doctor or a nurse or a phlebotomist or an occupational therapist, or if you're a medical biller and coder. You are required to adhere to a professional code of ethics in our healthcare world. So what does that mean? That means that we have a guiding set of principles that will guide us in the ethical interactions with our patients, their families, and the communities that we serve. We need to look out for their well-being, and the ethical principles are the pieces that guide us in those interactions. So let's talk about what ethical principles in healthcare actually are. So the first one that we're going to talk about is beneficence, which is a pretty big word, but what does that mean? That means that we are going to act in the best interest of our patients. So this might include pain management or not prescribing treatments or testing that are completely unnecessary. So let's say, for example, that a patient were to present to the emergency department and have pain in their abdomen. Well, the guiding principle of beneficence would dictate that we're not going to ask for an x-ray of their foot to diagnose pain in their abdomen. That would be a completely unnecessary test. Even though we could be paid for providing that service or doing that test, that would be against the ethical principle of beneficence. So hopefully that makes sense. The next one we'll talk about is non-maleficence. So that is, we will do no harm. You've heard that before when it comes to the Hippocratic Oath that doctors take when they get their medical license. But this also extends to other members of the health profession. So while we might not be providing, specific treatments as in performing surgeries on patients, we are nurses and we are prescribing medications or administering medications. So if you know that a patient has an adverse reaction to a medication, the non-maleficence guiding principle would dictate that you're not going to administer that medication when you know that there is an adverse reaction, right? Or anything basically that will do harm to a patient, we're not going to do it. This puts patient safety top of mind, which is absolutely one of the most important things in healthcare, making sure that we are keeping our patients safe. So that is the guiding principle of non-maleficence, doing no harm to our patients. Autonomy, that is the next guiding ethical principle that we will discuss in our class. So what is autonomy? That is making sure that our patients are informed about the services that they're going to receive and the options that are available to them. That's providing informed consent. It's one of the basic rights that a patient has, is being informed and being able to make informed choices about the healthcare that they deserve. So autonomy is giving them the ability to make informed choices and understanding all the pros and cons associated with any healthcare decision that they are going to make. Justice would be the next principle that we'll learn about in our class. So what does that mean? Justice means that we're going to treat all of our patients fairly. It doesn't matter if they make $1 million a year or if they don't have any health insurance or income at all. We're going to treat them exactly the same. We're going to treat them with value. That's very important, that we are just in the services that we provide. Fidelity is the next core value that we are going to learn about in this class. So what does fidelity mean? That means that we're going to be loyal and we're going to keep our promises. What else does that mean? That means that we are not going to promise things that we can't keep. So, if a patient were to present with a problem in the emergency department, we're not going to promise them that they are not going to be billed for that service if they don't have health insurance. We're not going to promise them that we can cure a disease. We can't. But what we can do is inform them of all of their choices and inform them of the potential pros and cons to receiving treatment and the potential prognosis of any diagnosis. We can give them the facts and let them make their own decisions, but we're going to remain loyal to them as well as their healthcare practitioners, regardless, again, of whatever capacity we are operating within. Veracity is going to be the next principle that we learn about in this class. That is being truthful and respecting the people that we are caring for. So we need to be respectful and we need to be honest. That's probably one of the most important things that we need to do. Don't sugarcoat things. Be honest in the services that you're delivering and the impact to the patient and to their families. That's super important that we are laying it all out for them. And again, going back to autonomy, making them have the ability to make informed choices because we are open and honest in our communications with them and we're loyal to them. We're not going to not provide services because they made a choice that we didn't necessarily agree with. They have the right to make that choice. In this class, we're also going to cover some case studies. So case studies are a great way for us to see how things have played out in the past and look at what decisions were made in the past and help us examine those decisions and what the thought processes were to make those decisions. So one of my favorite case studies that we're going to learn about in this class and we're going to talk a whole lot about is the Liebeck versus McDonald's restaurants case from 1994. You guys are all probably very familiar, at least you've heard about it, where a 79-year-old woman was burned by coffee and she ended up receiving a very significant settlement from McDonald's. And we're going to talk about why she received those funds and whether or not she deserved them. A lot of people initially believe that was such a frivolous lawsuit. Of course, coffee is hot. And we know the coffee's hot. But perhaps during this class, you will grow to understand why she deserved all of the money that she received. That's my goal, is to help you understand and critically think about the situation at hand, to understand why she deserved that money. And if she didn't, then let's talk about why she didn't deserve that money and talk through some of the ethical guiding principles for whether she did or did not deserve that money. Critical thinking plays a significant role in healthcare and plays a significant role in the ethics behind our healthcare decisions. We need to be able to think critically and understand both sides of every situation before we are drawing conclusions. That's probably one of the quickest things I see that, or biggest things, I guess, that I see that challenge people coming into this field. They're very quick to draw on their own experiences, their own education, their own backgrounds to make a decision and not fully understand both sides, the head of the coin as well as the tail of the coin, before they draw any conclusions. And the case studies that we're going to learn about will help us understand both sides. So I'm very excited to get into that. I hope you guys are looking forward to it as well. So let's get started.